You are live.
Thank you. Welcome back to the Vermont House Appropriations Committee. It is Monday, March 13th, 2023. Just took a little bit of break after we heard terrific testimony from the chair of healthcare, of House Healthcare, to walk us through their letter. And now we graciously have kept the Secretary of State's office waiting, and the deputy is here with us to go back to the subject we had this morning, which is the 3 compact bills. We wanted to invite you in to have comment on that because that's coming. It's going to impact your world. It's going to make a little bit more work, and I wanted to make sure how you felt about this. And I'm sure there was questions that I'm forgetting.
Sounds so attractive.
Thank you very much, Madam Chair. For the record, Lauren Hibbert, Deputy Secretary of State, and thank you for having me in today. These bills all have the Office of Professional Regulation and the Secretary of State's support. Compacts do a lot to help with interstate mobility, recruitment, and retention of professionals in our state. They also are the wave of the future in terms of what's next in almost all professions. We currently have 2 within the Office of Professional Regulation, the Physicians Compact. The majority of physicians are regulated by the Board of Medical Practice, but the osteopathic physicians, the DOs, are regulated within the Office of Professional Regulation. So we're part of the Interstate Medical Compact. And we also are part of the Nursing Compact that went through a couple of years ago. Both were good policy, and these 3 compacts are also good policy. I have testified about this in House Health, and I agree with you on your characterizations of the chair of House Health. She's fabulous. So the thing with compacts, the thing that the office is watching, the only caveat to compacts is just to make sure that we don't run into reciprocal discipline issues where another state disciplines a licensee for something that would be repugnant or out of line with the laws of Vermont. And post-Dobbs, we are concerned about this around abortion access and also gender affirming care. The compacts that are currently pending in front of your committee, we're concerned about it with mental health counselors and with audiologists and speech language pathologists. We don't see an active issue with PT, but mental health, I think it's relatively self-explanatory. And audiology and speech language pathologists do provide gender affirming care for people who are going through a transition. So we don't think that should hold up the passage of any of these compacts. It is just something that we want to make sure as we're part of the member states and working on rulemaking that we're able to ensure that we don't have to do automatic reciprocal discipline. And let me just say, so we had that problem with the Physicians Compact where Texas can, and I believe has now, disciplined a physician for providing abortion services. And if that physician was also licensed in our state, Vermont would have to automatically discipline in a similar manner. And so we want to obtain our independent state authority. And this is just something that, frankly, before Dobbs, people didn't think was really going to become an issue. And the Office of Professional Regulation was at the rules meeting for the Physicians Compact this fall. It was much more partisan than any other compact meeting prior. I think all states want to make sure that there remains 50 state or as close to 50 state participation in compacts. So some compromises and path forward is being created. So that's the only caveat to 2 out of the 3, but the office really supports these. There is a fiscal impact, which is why I'm here before you. Really, compacts mean that people who used to need to get a license in our state can use their compact license and practice here. So for the nurse licensure compact, which is in operation, a nurse from out of state used to have to get a Vermont license and now no longer has to. So we're not receiving any revenue. The three compacts that are in front of you, pending in front of you, there is a fee that is in different iterations of being set up. So that will be paid to the state of Vermont. It's just not clear what it will be in some instances. And then even then, it wouldn't offset what we would have received had that person gotten a full license. So that's the piece that frankly, we're still getting a handle on with nursing. We're going through our first renewal with nursing right now. Since we joined the compact, that renewal ends at the end of March. We're projecting that we're losing about a third of the nurses that we used to have, but we won't know that final number until the 31st of March. So.
Yep, go ahead.
Would you be willing to share that data when you have it? Because it seems to speak to what the risks are that we'd have to manage if we go this path.
Yes,
You're not losing the nurses, you're just losing them the funds,
that's correct. We're not losing the nurses.
just the dollars that they would have been.
And I know that. And part of it is I know how much licensing dollars means to the agency of education. So I imagine it's quite important to you too. And it doesn't look like a big sum, but it can actually be a position.
Right. No, you're absolutely right, Representative Holcomb. It does really matter. For nursing, we're projecting a $1.5 or $2 million revenue loss as a result of the compact. So it's not a small thing at all. But what is important to offset is the benefit of the compact and the public good that the compact provides. And I think that's true with all of the compacts before you as well. And we just want to make sure that we are watching that number that we potentially could lose, and that everyone is aware of the number of the amount of dollar revenue that we may lose as a result of joining the compact.
Go ahead.
So, given that the fund, the OPR fund, going to lose revenue, or is projected to lose revenue, and we're going to lose revenue for the nurse compact, how do we get out of that, or how do we get back to a sustainable level? I don't disagree. If it's the right policy, you got to do it and figure out a way to make it, and it very well might be the right policy. But I'm not sure, and I'm only speaking for myself, I'm not sure that I'm ready to say, okay, part of your OPR fund is now going to be general fund. So how do we, I mean, do the electricians have to pay more? I mean, I know you don't do electricians, but whatever. Some other.
Maybe she could.
She could, well, but no, that's, well, we had that conversation before, but do dentists pay more? I mean, I don't know what you see as maybe an answer, but I just don't want to see you get underwater too far.
Thank you. I also don't want to be underwater. And so we are in conversations with Ways and Means around a fee bill. I think that's part of the puzzle, although frankly, when we're talking about raising fees for in-state professionals to offset the costs of a compact, I do get, on behalf of Vermonters, I think we have to be cautious about that.
Yeah.
And I think we need to be, the way that I've been talking about this, and it's a little silly, is, if you go away on vacation and you plan to go away with 10 people and you rent a house and only 7 people show up, and instead of charging the 3 people who skipped on the vacation, you just charge the 7, then the costs for those 7 go up dramatically, right? And that's what happens with the compact. So, I want to be careful that we're not shifting on to in-state professionals the costs of the compact, because there are benefits to joining the compact for our in-state professionals. They can become part of it. They can travel. They can participate in an economy in another state because of their compact license here. So it's not without benefit, but it's not the same benefit as it is for the out-of-state professionals coming in. So Fees increases are a piece of it. I think there's small modifications that we can do within the Office of Professional Regulation, and we're really working on them. We have held back on hiring. We were given 3 positions last session that we have not filled, that I would argue we really need. 2 are related to home contractors. That program is just getting kicked off and will become mandatory on April 1st. So, our workload is going up as a result of that. And 1 is on mental health licensing. Licensing administrator for mental health. And our turnaround times, not to the detriment of our current employee who is a hero in mental health, need to be improved. And we only have 1 person in that position. And the process is very complicated and requires a lot of hand-holding. And we can do better, and we need another person. We have not hired into that position because of our budget. We're doing some other things. We're looking at our rent. We're working with BGS to reduce our rent spend. We are in leased space, one of the most expensive leased spaces in the state. And our lease is ending in June of this year. So we're trying to reassess what our next landing spot is, and we're doing our best to make that as cheap as possible. And then our IT costs, we made, it's easy to Monday morning quarterback a decision, but we made a mistake in 2017 when we went out for procurement of our IT system. We used our resources that we had in the OPR fund to build our IT system, and we should have come to the legislature and asked for an IT allocation as a reason, so that we could build that not with licensing funds, and we would be in a different place had we done that in 2017. So we are trying to reduce our IT spend month over month, and we are seeing evidence that those small adjustments are helping us in terms of where we're going. But there is a conversation to be had, and Representative Harrison, I'd love to get you over to where you feel very confident giving me a general fund allocation. No, I'm not even sure that's the right. I'm not even sure that's the right approach, but I think it's an ongoing conversation and one that we should engage in.
Anybody else?
I just got to say, because I've been on the other side of this far too many times, sometimes the benefits actually aren't, it's not limited to benefits to licensees. It's the reality are we getting more services? Are we actually bringing new nurses in, new mental health clinicians? And those will never appear in your budget, but they do save costs. And I'm just so mindful that if we don't fund our core agencies and the core functions of government, we actually lose incalculable value other places too. So we just have to pay real attention to that. And we're seeing it in mental health as well.
Absolutely. And I think, the healthcare industries and associations and institutions all support compacts, because it means that somebody can start this afternoon as opposed to in 2 weeks from now. And that's the public good that's really will never show up in an OPR spreadsheet. It's very hard for me to even forecast, but is very concrete. With all these 3 compacts, with the nurse compact, with the physician compact, one of the major reasons why our office supports it is because of the assistance that it provides to the marketplace to get professionals in place to provide the services that need to be provided this afternoon. So.
Representative Toledo.
Yeah, just to that point, I was talking with a friend who moved back to Vermont after 20 years in Indiana, who's a physician's assistant, has a position, could start tomorrow. It's going to take 2 to 3 months for the licensing work to get done. Because there isn't a compact for that particular role. So, and it's going through some a third party. It's not this necessarily even the state that's taking, it's not Vermont, I don't think, that's taking the time. It's just, but that's a very concrete example of where.
Representative Harrison.
To that point, how does it work? Let's say we have this compact and someone moves to Vermont, which we're encouraging. they're already licensed, so they're good to go. But what happens going forward? Now they live in Vermont. Do they renew in Vermont?
Yes. As soon as you become a resident of Vermont, you then need to get a Vermont license. So
Oh,
you
so it's not even on the expiration 2 years later?
no, it's
Okay.
when you change your residency. So,
Okay.
you know, a lot of the work that people do under a compact license is temporary. For instance, traveling nurses, they're not residents of Vermont. They're just here for a stint. They don't need to get a Vermont license. But if that, you know, the stories I love are when a traveling nurse comes to Vermont and decides to stay, like, please stay. And then we get them a license. And those are the stories that I actually have been asking our team at OPR to collect, because they're the stories of what we can do to keep people here. And, you know, with nursing in particular, we just don't grow enough nurses within our own state. We don't have enough slots in our state system to educate the volume of nurses that we need, new nurses that we need every year. And so we have to recruit from other states. So if we can get somebody here on a compact, temporary basis and convince them that this is the place where they want to stay, then we've all won.
Representative Page.
Being in a compact, if you're from another state and that other state is your residence, you still pay taxes on the money it's earned in Vermont. Is that correct?
My understanding is, yes, you still pay money on the monies earned in Vermont. I'm not a tax lawyer, so I don't know whether any of that revenue comes to Vermont.
I have a friend here. Well, so as somebody whose husband is self-employed and we pay income taxes in multiple states across the country, you pay as a non-resident, and usually non-resident tax rates are a little bit different. Now, I'm not sure whether Vermont actually has non-resident, I could look that up, but in other states, you pay a non-resident tax rate, so you're not subject to all the other things that a Vermont resident might be subject
Yes,
to.
it's usually prorated based on your,
Amount of time.
If you earn, if you made a grand total of $10,000 and $3,000 of what was Vermont, you only pay taxes on the $3,000 that's in Vermont, not on the whole $10,000 that you made elsewhere.
That's good.
any other tax questions you have, Woody?
Yeah, no, that's. I'm just.
Representative Brennan will
You got
tell,
one?
hold court after.
Looking after our fiscal responsibility.
You are? Good job. I love this committee. Love their mindset on a problem. So if I'm going to recap for you, and then we'll go, is that the three bills, the Secretary of State's office and supports all three bills, understanding it's going to have a bite on the impact. You're working with Ways and Means on a variety of ways. You don't want to shift the cost to the in-state people, but maybe there's other ways that you're looking at. And in particular, now that we've got more data in on what we've passed before on the nurses and the physicians one, you can actually see
That's
the impact that's having on there. So,
That was a beautiful synopsis of what it is.
okay, thank you. All right. That's good. All right. Thank you for coming over.
Oh, it's my
I'm
pleasure.
glad that you're so close.
Yeah, anytime. I'm happy to come. Thank you.
Work on your
Thank you.
lease, right? Yes. So tomorrow morning, ladies and gentlemen, 8:30, Representative Wood is going to be able to come in. So it looks on our schedule at the moment, although Erin's probably already
She
updated
is
it.
updated, she's totally on it.
She's totally on it, and except for my hard copy. So Teresa will walk through Human Services tomorrow at 8:30. And then whatever else we're gonna do, and then we're gonna keep plugging away on things, big gaps the rest of this week. Maybe we should go back to the B sections, language sections. Talk about things.
We skipped over a lot on the web report, maybe, I know a couple of my areas I skipped
Yep.
over, I can.
Dale, we didn't want to talk about. All right, so why don't, then we'll go what I call combing through that. Sometimes you think, oh, that's pretty, that must be in good shape, and then you go through it again, you go like, oh God, no, there's about. So keeping a good eye on now, things that we're hearing from committees that might be requests in there and or from our gathered, and I point to the arts and the stuff because we know there's 150, there's 54 for that, and we've heard some other things that we make sure that we're accounting for, and I'm even hearing this morning what's not accounted for, that the administration has also let us know that, oops, they forgot to include the salary for,
Well, we have some money that was left out for truth and reconciliation, the racial justice statistics, 3 positions. and
Those
then
3
there's a
positions were
council,
not-
And then a few other things. So I'm actually having a conversation when we're done here with Susanna.
okay, good.
To
And
get an update.
get an update of what's missing that they wanted to have in, but they didn't put in, and then what's missing that maybe they didn't, it wasn't a mistake, but we might still want to consider.
Well, this was based on legislation that was passed into law last year that hasn't been included in this year's budget.
So we're going to
So it's
consider that a
required.
mulligan? That's a mulligan? So, all right. Anything else? Is there anything that I can do for you in this next week to help us, to help you succeed with what you need?
Sure. Make sure we get breaks.
Cookies.
All right?
Before 3.
Why don't we just make sure we just go get some at 12:30 that we have them
schools
schools?
over, yeah.
Okay. And you can always get up and go anytime you want.
I'm gonna bring you
I'm good.
Sometimes all right. All right, so tomorrow then we'll do that, and hopefully then we'll be in a place, we'll just vote these 3 out. And then we'll wait for the Ways and Means to release the hounds out of their room. They've got 3 bills that are gonna come. All right. I don't, I spend a lot of time looking at the box, and every day the box just keeps getting, well, yeah.
Changes.
The number's not gonna change. We know what the revenue is. But what we have to fit in is getting tougher.
As a newbie, any guidance, I mean, I'm looking at these bills coming our way that have financial implications, and I don't know how.
I'm
we
trying to
fold
put
them in.
together
Yeah.
we gotta
And some of
account
them
for
aren't
them.
gonna, we can account for that, they're not gonna get here in time, some of them as
They
well.
have to, or they
Well,
don't get done.
Well, for example, there's childcare, but it has to come out of the Senate.
Oh, yeah.
But we won't know what that looks
What's
like,
that, right.
So I assume that.
We're gonna hold some money for
Okay.
that, which we know there's like 55 million of ongoing right now in
But
the
there's
budget.
new ongoing, yes.
Yeah.
Yeah,
So
and I
there'll be-
think you can fence the positions too,
Yeah.
because
We're gonna have
depending
to,
what they pass.
like hold something aside.
Yeah.
Yeah.
Just to add on to what Representative Holcomb said, like the presentation we had today on healthcare, how do we fold that into our B sections?
So,
We'll do it all Thursday and Friday.
yeah. So if I,
Next week.
I have the same question, because I can't figure that math
And
out.
that's why we have
so I get
Maria.
to,
Thank
yeah,
God for
exactly.
JFR.
They're tracking. Do you remember the sheet that you went home with?
Yes.
The big one that's got the ongoing dollars on one side with the other revenues, and on the back is all the one time?
Yeah.
So I play with that, like as if it's my home budget. It's like, okay, what is this all in here? And it's like, oh, now okay. So then I take a look at it. I make notes. I know I'm old fashioned with the pencil, but like all of their asks, these are all the letters. So this is by committee, what they're asking for that's above the recommends, or if there's other things that they've given back. They're also did a pretty good job of saying, nope, take that 10 million. We don't agree with that. Take this. Okay. All right. So I track that on my that big tracker, and then go through and you heard me say to the chair today, it's a 2-year pilot. Oh, 2 years. Yeah.
So everybody should read all the
Right, if
letters,
it's
don't
2
just
years.
read your own, because it
It
all
all
comes
relates.
together, and we all should know,
So when
How all
they're,
the
yeah,
pieces
if it's 2 years,
do we need to do?
do we put it down, and then we can do the Dear Jane and Mary letter if we need to at the end of the year for things that. But I'm hoping that I can work with people that, I also want, Representative Mahali sent me, he's not here at the moment, he had a meeting, but like a nice letter of like all of it. Some people have said, what these are within your world, or when we went through the budget tomorrow, things that you're starting to hear about. I don't know about you, but I need to go back. There's 2 committees I need to go back to. And tomorrow is judiciary. I can't make heads or tails of their whole letter. And Commerce is working on a workforce bill that we care a great deal about. Workforce is a core thing. We don't know when we don't know what, I don't know. I know I'm gonna go visit with them and find out my goals by the end of the week, so we can start to knit this together. And then we'll come up with ideas of like, well, Sarah will come back with, here we are so far. Here we are if we do this. Here we are that's still outstanding. Here's what, so right now, my best guess, and that's scrubbing it, and what theirs is, we're still off 30, 40 million.
Well, then you have a lot of the public requests too that.
Yeah, some of them were in
didn't
there.
all go by committees.
No, right.
Right, some did.
Some
Some
did,
didn't,
yeah.
right.
But it's just me personally, have more weight when it's public hearing plus committee's jurisdiction, plus, and is it 10 million or is it 50,000?
Right.
And how can we take a look at some of the ones that are 10 million and if we can realign them in a new way. So all of that will start to come a little clearer. I'm sure you guys have ideas as well. The other thing that we've got is Wednesday, 11 to noon, is legislators are going to come in and weigh in as just people. And that all came about years back. The Appropriations would get a flurry of maybe 15, 20 amendments on the floor to drive home something that, they want it for the Northeast Kingdom.
What do you always on the floor with the
It figured.
And then they said there were
Don't forget,
people there.
don't forget, I was in the healthcare committee.
I know.
It's perfect. You're not here by mistake, sir. You're not here by mistake. And anyway, so feedback to that committee, maybe in 2012 or something, is like, but we have no way to talk to you. No way to get to you until you bring the budget to the floor. So standing committee letters, maybe it didn't fly in that room, but they had no way. So allowing for legislators to be able to come in and we'll see what they have to say. And they'll add to that big list. Yes, ma'am.
The other thing I struggle with is, seems the standard component in every letter is a request for base funding as opposed to one-time funding. And I don't mean to chuckle about it, but it does seem to be the word got out that base funding is the way to go. What I struggle with is, yes, our task is to focus on fiscal year 24, but the future years is where, a focus on base funding today has a huge impact on what
Our ability to fund it in the years.
to fund in future years. And that reality, knowing that we sk and achieve a balanced budget, is just something that I personally worry about. But it becomes, I think, a real challenge because I know that some issues about even today some issues are vital, and yet to kind of look at that through a more scrutinizing
Be able to fund
eyes.
what is vital.
Which
is why, like, I see what's like, oh, this is a great idea, and it's, we can't, that's the one I said, Adam, if we're not able to cover the groceries, we're not planning for vacation.
Anyway, just to.
Yeah, so it's hard.
We could all share.
So one of the things I'm gonna ask, I know that you guys are sharing that one, Representative Squirrel, is I saw in the letter from Energy, speaking of that, is the Lake-wise.
Yeah.
I don't know, there was no number, dollar value. I don't know how to account for that in a.
Well, the question is whether, how many positions we might want to have.
Mm.
And then we'll put a number to it.
And that's all that is just positions in the Lake-wise?
Yeah.
Or is there, okay. Pardon my ignorance on that. I know it's important. We've heard about it. We've heard, Yep. Okay. Well, look who's here. Look busy.
We do have to, we can go.
We're wrapping up, sir.
Hours trying.
All right. Anything else that I could do to be of help this week? Want you to be successful. Because if you're successful, I'm successful, and if we're successful, the whole house is good, and then the Senate will just be able to go home early.
Well,
So not only do we work on our budget, we have good communication with the Ways and Means Committee about what they're doing as well, and what they're not gonna do. Is that
Have they signaled anything? Do we even know what?
some things?
Yeah.
Some things, directions. Okay, so today's Monday, we have dinner, tomorrow's busy day, caucuses, Wednesday, members in, floors at 1. The good thing is that even if we got done early, there's gonna be late night floors the next 2 weeks. And then prepping for any moment that you have, because you're gonna be prepping for your floor. Right?
So
And
we'll be working on probably Thursday and Friday,
Of the-
2 weeks from this week.
so
yeah, go
to
ahead.
that end,
Yeah, let's talk about that.
would some of the seasoned members of the committee be willing to
Yes.
just send us an example of how
will.
you reported out last year?
I'll bring my whole book.
So I can tell you what we
I see.
did the last biennium is that the chair decided on the order and it wasn't, and we didn't
Yeah.
so we didn't do the budget in chronological order, jumping around between people.
Yeah.
We did the people who jumped around within the order of the bill. So you want to be able to orient your folks very clearly to, I'm in section this, it's on page this, and that,
That's helpful.
The other thing is the chair gave us 10 minutes total.
All your budget.
For your entire.
It's actually
budget.
6 minutes.
Yeah, last year we cut it back. 2
We
years
cut it to
ago.
6 minutes, yeah.
Okay, but- because if you do 10 with 12 people,
Yeah,
it's 2 hours.
yeah.
It's a 2-hour presentation.
Plus, no, you got more, then you've got.
We could just
you've got-
let the chair do it all.
I could just do it all. 22.
It worked pretty well the last time.
So
We worked so hard to try to get it under 2 hours.
So if we did 6 minutes with 12 people, that's 72 minutes,
Yeah, it's
right?
still a long time.
It's still, it's like
takes-
an hour and a half no matter what
I can be
we
very
do.
brief.
You can be brief, 2 sentences.
What's
No.
gonna be hard is some of you have things that are much more, the human services budget, several of you have, and then the workforce and employment budget. So there's, and healthcare, I mean, there are some really big ones. So those of us who don't have the really big ones will try to be shorter.
Some of them we won't even do,
No, they're all
but if normally it would take, if you just take 2 sentences for your piece, right? A little bit, it will take 3 hours to get through, just to get through. And then you say to yourself, okay, I'm gonna report on section 309 is this and it does, and then we went along with the governor's recommend, but we made this ad, right? Then you go to the next one, right? So you've got your briefing, but in your book, you want to be prepared to say, somebody stands up and says, who does blah, blah, blah? And can you tell me if this or whatever? You want to have with you on your tabs, like your book, your binder for just your bills, or not your bills, but your sections, that you have them tabbed out by section and that you have the backup information. How many nursing homes do we have? And did any of them close last year? And what are we doing,
Now, Chair,
Yes.
so that's a good question. I mean, that's a good example because is that a question that we would answer?
Yes.
Or is that the policy committee?
Well, it could be, if you have it right there, if it was a
Yeah.
part of.
Okay.
If you have it and you can say, we heard testimony and we understand this and we're supporting, this is why we supported X. If you've got it. And if it's not something, you go like, oh, that's way out there. I have no idea what that answer is. And your policy liaisons for those committees that you're working with could be of help on the floor. But you need to communicate with them and ask them, would you be willing to, if this gets off the rails, would you be able to speak to, I will look to Representative Holton when it comes to certain things too. She's got this. Representative Woods, she's got this. Yes, sir.
if I may also suggest that you're doing most of your talking in second reading.
Right.
So you can always say, I don't have an answer for that. I'll figure it out, get back to you personally.
Right.
That's always a good way to respond.
This is where caucus of the whole is so important to get all the questions and, you know, going to caucus with a handout, going to caucus and making ourselves, we did not do this year the budget buddies. We haven't done budget buddies. We could.
Although I have to say that in the 2 years, nobody ever responded other than thank
The
you.
only one who ever really harassed me was somebody,
Over
I
there,
can't remember who it was,
somebody in the,
Oh, it's Kari.
but you know, everybody is different in their comfort level. So if they would never maybe ask and they might have a question, but if you went up to them and you said, Representative so-and-so, I'm your budget buddy, and do you have any questions on the bill? And they might go, no, but oh, by the way, do you know anything about this? And you can be so helpful to them as well as it's just, sometimes they're, you know, we can be scary.
Well, it's.
Especially me, I'm super scared.
It could put you could put them in touch with the right.
Right, exactly. Right. All right.
Minute, one more observation. What was very interesting, just from process-wise, is that here we had, I would see that there's kind of the governor's recommend, the policy committee, there's certain layers of, on how to present whatever we end up with. But I thought what was really telling is already in this case, we had the policy committee already compromising on their set of recommendations. And
then we'll do even more so.
Yeah, right. I think that's really helpful just from, in terms of helping us evaluate the priorities in this committee. Know that they've already done some of the homework for us in
Right.
narrowing down what the
Job.
priorities need to be.
Some are better job than others as far as helping to guide us through what, if you have money, start here.
Right.
And go to 2 and go to 3, oops, we're out of money.
Yep.
And we just go as far as we can. And then, so that's how we approach it when you're looking at all those dollars. What's the critical thing? And we're not going to get to the vast majority of what's left. Okay?
And on that,
So much fun. That's why you came to this room, right? All right. 8:30 tomorrow, Human Services.
thank you